Furosemide is a potent loop diuretic sold under the brand name Lasix. The purpose of this video is to increase the knowledge and understanding of furosemide. Drug overview. Furosemide is a loop diuretic given by mouth or intravenously. It is frequently used for treating conditions characterized by fluid buildup, such as congestive heart failure, liver disease, or kidney disease. Furosemide can also help in managing essential hypertension, since it reduces the fluid volume in the blood. It is effective in increasing urine output and used in many different clinical conditions where there is a potential risk of fluid overload. Classification and mechanism of action. Furosemide is a loop diuretic that affects the ascending limb of the loop of Henle and participates in the reabsorption of the substances. Furosemide is an antagonist that inhibits the sodium-potassium chloride cotransporter, which causes a marked effect on the levels of sodium and water excretion. Both cause diuresis to minimize fluid concentration that settles in body tissues and lowers blood pressure. Furosemide directly contributes to symptom relief of edema and hypertension because of its ability to increase the amounts of fluids excreted in urine. Side effects and adverse reactions are decreased blood pressure, decreased potassium, electrolyte imbalance, ototoxicity, urinary system problems, and diabetes complications. Also, a rare side effect is Stevens-Johnson syndrome. Patients on furosemide should be monitored frequently to identify such side effects. Client and family teaching encourage patients to take furosemide early in the morning to prevent nocturia and sleep interference. Patients should weigh themselves daily after their first void and before breakfast in the same amount of clothing at the same time every day and report any weight changes greater than or less than 2 pounds. Also, teach signs and symptoms of electrolyte imbalance, such as muscle cramps, weakness, difficulty with balance, dizziness, or irregular heartbeats. Recommend eating food with potassium as it is a potassium-wasting diuretic. Important nursing interventions labs should be monitored for electrolyte imbalances and kidney function. Also, monitoring fluid intake and outputs, weighing patients daily, and monitoring blood pressure. Educate patients on the importance of compliance and the potential side effects of not taking the drug. In conclusion, furosemide is a loop diuretic used in managing conditions of excessive fluid volume and can remove too much fluid, causing hypovolemia. So monitor blood pressure, intake, and output and renal function while taking furosemide. Also, consuming potassium through diet is important for the nurse to remember for client teaching.